Hi, my name's Louise. I am the admin support in the OD team, and I've been working on organising the Wellbeing Festival, planning all the schedule and the sessions, and making sure that everything runs smoothly. So we hope you've had a really good week. And I'm joined today by Suze and Louise.
Hi, I'm Suze. Yeah, Suze Johnson from NHFT. I work in the communications team on internal comms. And now I'm going to hand the baton over to Louise Kirby.
Hi, I'm Louise Kirby, and I'm going to chat to you about my role in raising awareness and understanding, really, of neurodivergent, particularly actually autistic people. I joined the trust in 2017, and it was a new role from the Transforming Care agenda after all that awful Winterbourne stuff, and it was about raising awareness and understanding of autism, as well as working on the very first county autism strategy. And it was a bit different because it wasn't just in NHFT, it spanned across social work and provider market. So it's easier now. We have the integrated care system, so that's really helpful. When we were developing the strategy initially, we unfortunately found that a lot of autistic people weren't having really very good experiences, and they were saying that actually there's a lack of knowledge from professionals in understanding why they behaved as they did, and from that we decided to do something about it. And what we decided to do was create a network. And the idea was that I single-handedly couldn't possibly tell the whole county all about autism, though I tried my best. And we got together autism champions, and they were anybody from different teams and organisations who cared about autistic people and cared that they weren't getting equity of access to services and not having great experiences. So you didn't have to be an absolute expert and know masses. You just really had to care and want to do something. So we all got together and we decided our vision would just be to improve experiences for autistic people. And this is across the county. And we felt that lovely community of practice, but what we would like most of all is to hear the actual experiences of autistic people. So within this network, we have as an integral part, absolutely as equal partners, autistic people who are able now then to have a platform to share their stories and their frustrations. And actually, it's gone from strength to strength. I'm really proud to be involved with it. We evaluated it quite early on because obviously we wanted to see if it was doing what we wanted it to do. And initially, I thought we had presentations about particular topics, and the idea was that you would disseminate what you'd learned to your team. And I thought that's how knowledge is going to be raised. But when we did the evaluation, we found that it wasn't. It was the sort of social learning, I suppose, the developing relationships, interacting with autistic people outside the clinical, when you really got a different perspective and understood the challenges of day-to-day living rather than just that clinical appointment. So that was I think that was the main benefit. And also about sharing resources, because now I think there's 157 autism champions, about 40 autism advisory panel members. So sharing resources is great. What a pool of knowledge we have all together there. And also people can put out questions to the network and get both the autistic viewpoint and other professional viewpoint to help improve experiences for autistic people. So that's the increasing knowledge bit that my role has encompassed. There's lots of other bits and bobs as well, like the Oliver McGowan training rollout and sensory projects and things like that. So it's varied. It's a great role, great opportunity.
That sounds brilliant, and it's a great support to everybody within the trust. So we've heard from a few different colleagues this week that live and work with the neurodivergence. So what advice could you give to us as colleagues to better support anybody within our workplace, within our teams that may have a neurodivergence like autism or dyslexia? What can we do as a colleague to be more supportive and make things easier for them?
I think terminology is quite an important thing. I think as NHFT, we are a health trust, so we do tend to think about the medical model, where of course our understanding and knowledge of autism has moved dramatically, really, over the years, and our society has as well. So we were wanting to move away from a medical model of autism, think more about neurodiversity, and that includes thinking about the language you use. And what we have decided to do in our paperwork and so on is to follow the Kenny research advice from some time ago now that looked into how autistic people like to be referred, and that was as an autistic identity first. But professionals tend to feel more comfortable with autism. Research continues to come out, and what we find is that feeling positive about your autistic identity is like a protective factor to maintain your mental health. So if you're obviously, I suppose, if you're feeling good about yourself, things are better. So feeling good about being autistic is really important. And traditionally, I suppose, it's been a bit about impairments. Obviously, it's a diagnosis, so it's talking about impairments, but living and internalizing that you're an impaired person isn't great for your well-being. So I think it's really important when we are speaking and referring to autism that we don't perpetuate a negative perception of being autistic, but also to really listen and respect to how that autistic individual wants to be referred to and how they understand their own autism, because that's the key, of course. So we would reflect the language that they would use. So I think that is supportive. I think using outdated language or disliked language could be construed as a lack of understanding, possibly. So thinking about that, and of course it's all about being person-centered and chatting, understanding that person's needs, how their autism affects them, their sensory profile, that sort of thing, so that you know what reasonable adjustments are going to be helpful. And if they haven't, probably they might like to fill out a health passport with their manager to discuss again what their autism means to them, and recognise and agree reasonable adjustments that would be helpful.
Brilliant. And of course, we know that, people with autism and other neurodivergence bring a whole different skill set into the workplace. So they're absolutely a benefit, the skill sets that they have that for example, I wouldn't have. We have a colleague who's exceptional at spreadsheets and picking out data and following patterns, and that's something that I can't do. So that skill set is invaluable, to us as a team. So absolutely focusing on their strengths is key as well.
Mm.
And on a bigger scale, obviously you've done a lot to support the trust. What are the biggest things that you've sort of implemented to support colleagues within the trust, and any advice that you can give to other organisations to implement, small things that they can implement quickly to support colleagues?
I think the Autism Champion Network is a really good thing to get involved in. I still think there is some stereotyping, and that we need to move away from that. We have got you can find on the internet guides if within NHFT for helping managers support autistic people, just gaining understanding, a bit of a background. There's also reasonable adjustment toolkit, which was originally promoted, thought of, to support service users, but actually is equally important for our colleagues. And and you can also get involved with the strategy, of course. The things that need to be improved and so on. We are refreshing the strategy at the moment, so really keen to hear about that.
Lovely. So, Louise, I was just thinking about if someone's worried about talking about their neurodivergence with managers or colleagues, what advice would you give to them?
As in our NHFT DIGBQ strategy, we have got an action or an aim to support opportunities for neurodivergent, well, autistic individuals to disclose their autism. It's not necessarily an easy thing to do, because I think there are still some sort of thoughts that you can spot an autistic person. Sometimes even people are still thinking autistic people have a learning disability. Of course, that's not the case at all. So I think it's still, in some areas, there's a little bit about increasing knowledge for us as colleagues. We had an idea, which I would very much like to pursue and would be interested in what people think about. It was to have a subgroup from the staff disability and long-term network purely for neurodivergent colleagues, and that to be a safe space for you to be really open and honest about your experiences, about unconscious bias, intersectionality, the minority stress type things that you might not feel comfortable talking about widely. And then I think we can work from there to increase knowledge, exactly really the same as we've done for race and unconscious bias in that respect. There's a lot of yes, the intersectionality is something that we need to be thinking about. So you could, I would think you could get in touch with Jane Evans, who's leading that, or also myself, who's leading. Jane Evans leads the network, not the subgroup, which hasn't started. And then if we have confidence, it makes things so much easier in it, that you'll be respected when you're speaking about your differences, because as a hidden disability, it's quite hard for neurotypical people to understand the difficulties because it's absolutely not in their repertoire. So about being accepting, isn't it, and validating other people's experiences. So as well, there is the stuff that I've mentioned on the intranet that you could also refer to, and you could, if a health passport hasn't been suggested, you could perhaps suggest that and go through that. I don't think it's easy, necessarily. Sometimes it's more easy than others. It depends how you feel yourself, I suppose.
Yeah.
And of course, just to say, this particular part is NHFT specific, but across the system, all the organisations should have their disability networks that, you know, with a lead that people can approach and get that information if it's required. If they need somebody to speak to, then the disability network lead within your organisation is a great place to start, isn't it, Louise?
Absolutely. And disability is an interesting word in another discussion, really, because some autistic people would think that it isn't a disability. Others will say, yes, actually, absolutely, it is disabling. So terminology is very tricky.
It can be. I definitely think you're onto a good idea there, Louise, in the respect of another avenue of a network group in some respects, you know, so you can actually focus on that conversation with those individuals and help them, like you say, have a safe space to talk about what they want to talk about, and everyone feels like they're in the same safe area.
Absolutely. And thinking about aspirations, it would be lovely also to have a clear separate bit on the equalities part of our intranet as well, because I think as much as we, or I in particular, shout about it, it isn't very visible on the internet. We have got stuff about the strategy and the network, but it's very hidden. I'll be very impressed if people can find it. So it'd be really good to have that out there and show that we're really understanding that autistic people are less likely to be employed. So if we've got autistic people within the trust, we want to treasure them and support them to be successful. And also the lack of equity generally for autistic people accessing services.
Yeah. I was going to talk about how what more we can do as organisations to better support, but I think you've already covered that. So I suppose I wanted to look more into the Champions Network that you talked about, and that you've got over 140 people signed up to that, or 147, I think it was. I think you said. So how do people sign? How do people get in touch and sign up and start to be involved in that network?
If you want to be an autism champion, you just need permission from your manager, and there is a special Autism Champion Network email address, which is autismchampionNetwork@nhft.nhs.uk. So do ping us an email over there, and then because it's a network and because I am conscious that people might see other people's email addresses when I send out Teams information, for example, and we do ask that you sign to say that you're okay with your email being shared. But I do make my best efforts for it not to be particularly crossing over with autistic people who could potentially be service users, that sort of thing. So I'm very aware of that. What we would like from an Autism Champion is that they have an action plan for their team. So they think about, I didn't say this, but earlier on, the network co-produced local standards for supporting autistic people. And of course, we've got core capability standards as well for supporting autistic people now. So referring to those and referring to the actions from the strategy, create an action plan. So just pick a little thing. It could be about your environment, maybe, or about your a letter that you send out, to look at that and check that it's accessible for autistic people. So it could be to adapt our invitation to an appointment by including visual pictures of where you're going to go, where you're going to park, and that sort of thing, to make it more accessible. And of course, all these things that make things easier for autistic people make things easier for everybody. So an action plan is great, because then it shows that it's having impact and we're actually making a difference, and that can be shared and celebrated. So that's the two things from the Autism Champion. You can come along to network meetings. They're usually online, though we're going mad this month, and we're having one face-to-face, which is the first time since COVID, actually. So it has a bit of a different feel to it, and it gives a real opportunity, I think, when you're face-to-face, to interact with the autistic members. You can then also email into that address that I mentioned with any questions. If you've got a query about something. Recently we had somebody who was tried all sorts of things that they could possibly imagine about a young man living at home who wouldn't eat meals with the family, but deeped down into the crisp cupboard at night and had all the snacks, and then wasn't even very it wasn't really very sneaky at all, because there was evidence all over the place. Anyway, this question went out to the network, and some really interesting insights from autistic people saying, of course he's not going to be able to sit down in the family meal, because the sensory experience of that is so enormous. The proximity of others, the smell, the food, the noise, it probably was overwhelming and not something they could manage. And also that eating crisps and those sort of snacks, you use your hands, which might be helpful, rather than because you get a feel of it before you put it in your mouth. And also that they are often, just perhaps not so much, but they're often very reliable and the same if you stick to the same brands and things. So that was quite insightful. And then those sort of knowledges, learning is spread across the whole network. So that hopefully helps not just that person, but all of us. If you wanted to be an Autism Advisory Panel member, which you can be as a member of staff, if that's the way you want to go, you do the same. Get in touch with us on the Autism Champion Network email address, and the same with the contact details. And we do ask to sign a consent form, which says, well, sort of the usual, explaining confidentiality and so on. And also joining the NHFT Involvee programme is a good idea too. And then equally, you're invited along to the network meetings, and you can tell your story, and you know that you're going to be in a safe place. Nobody's going to judge, and it's all okay. And just mention also that when we do online, the Teams network meetings, we don't record because we really want it to be somewhere where you can say what you really feel and that it's safe.
It sounds a great network, and the advisory panel actually to be involved, isn't it? The knowledge you gather from that and the learning. Yeah, totally.
And it's great that we've got all this implemented already in the trust. But any other organisations potentially watching this who would like to implement something similar, who perhaps don't already have it in place, what advice would you give to them to get it started? You know, how did you start, you know, all of this, and what's the first port of call really if you want to kind of implement these things in your organisation?
Well, actually, published last month, well, open access available last month, is a paper on raising knowledge through a local Autism Champion Network. So that's in the Autism International Journal. So you can look online at that, and that does give tips about starting a network if you should wish to do so. And I think what we found is that it helps to have a clear one person who people go through, and this isn't the paper bit, but going forward for the autistic people themselves, they felt that it's nicer to have me or someone as a gatekeeper, so they don't get bombarded with emails and then feel obliged to do things that they might not feel comfortable doing, and we don't know who else is emailing them. And so they did say that for the initial contact anyway, it's good to come through me, because they said that they're happy to say no to me, which which is good. Well, we started was just word of mouth, really. And I think it's important that everybody's there for the same reason. We're there because we want to be there. Nobody said, oh, you've got to go and be an Autism Champion. And you think, oh, this is something that you're really interested in and you really want to make a difference. And it's amazing. And the atmosphere can be amazing in these network meetings. And you really get a feel of connectedness and a sense that you're all wanting the same thing and going in the same direction, or trying to.
I think yeah, perfect. I think we will definitely add that email address at the end of this recording so people can access that and come along and learn more and share more, no doubt, I'm sure. The other thing I wanted to talk about, Louise, was the creation of the autism guide within NHFT, because I know you've been very much behind the driving force of that. And I suppose I just wanted to talk more about that and why you felt it was important we did such a piece of work.
I think it's important because sometimes managers aren't quite sure how to support and what reasonable adjustments are reasonable, and and that sort of thing. So I think that gives a bit of security and consistency to have a brief guide, and it is telling you a little bit about being autistic, and it's co-produced, of course, with the Autism Champion Network members. So and it includes a word cloud, I think, from them about how they think of autism. It advises about how you can support and gives you a little bit more of an idea of confidence, I hope, in supporting your autistic colleagues who you may not know are autistic, or who may not know they're autistic themselves. So I think keeping an open mind and helping individuals. I'm trying to think what we put in the autism guide now.
It's like you say, it was a guide, wasn't it, to help people reach out where they needed to, and you know, use it to help them perhaps have those conversations when they need to.
Yeah, absolutely. Yes, I think so, and give people confidence. And I think there can be a fear that autistic people are somehow terribly different, but actually we're all people.
Yeah, totally agree. So I suppose just as a final point then, Louise, is there anything that you want to reach out to for people today to say, this is what I think we could do, or this is how you can get more information, or, you know, is there one key message that you'd like to share with people today?
I think for staff members, I think if you're autistic and would like to have an opportunity to network with other autistic people within that, as the subgroup of the disability network, please get in touch, because I hope it would be valuable. And obviously, if people don't think it's valuable, we won't do it. But if you think that it would be good, let's get together and do that, and promote reasonable adjustments and understanding across the trust to support people to be as successful as possible in their roles. And also, I think, to think about in our recruitment how we make it equitable for autistic people to apply. And that's something as well we might want to think about as a group of autistic colleagues. Obviously, the Autism Champion Network, if you're interested, do get in touch via the email address or the Autism Advisory Panel. Something I haven't mentioned is that there is also an Autism Enabler Group, and that arose from the Autism Advisory Panel, really. And the Autism Enabler Group is seeks out and amplifies the less heard autistic voices. So we mentioned intersectionality before, so that as in any community, there are less heard autistic voices, such as the homeless and things like that. So that's another area that we look into. And the Autism Enabler Group links into all the pillars from the ICB, so hopefully informs service development in all areas to take into account autistic need.
Thank you, Louise. I mean, your passion for your role really does really does shine. And just want to say thank you for everything that you do. You really do make a difference in what you do and how you support other, colleagues and others and all those champions. It's fantastic. Thank you so much.
It's very kind of you to say so. I normally feel I'm just a terrible annoyance going on and annoying people. So remember, autistic people. Thank you. It's been great to have the opportunity to talk.
You do, as Sue said, you do an amazing job. And, if there's other organisations out there that want to get started but can't, hopefully this will kind of give them a bit of encouragement and a bit of advice as to how they do that. And yeah, continue doing what you do. Thank you.